glad you're here and glad the family's here also. 20% of the state's population in Nevada is on Medicaid, and another 15% of the population is on Medicare. And we discussed in my office how important it was for you to strengthen and protect these programs and how critical that was for the state of Nevada. I just want you to know I appreciate the conversation that we did have in my office. And like everybody else, I would assume on this committee that everybody's a strong supporter of Medicare. And I share that. And I will say also that I have not supported, will not support legislation that does weaken Medicare. Before I get started, Mr. Chairman, and I'm quite sure who's playing Mr. Chairman at this point, I'd like to submit for the record a letter that I received from the Speaker of the House in the Nevada legislature and also the Majority Leader. I asked Secretary Price if he would...
Without objection, it'll be made a part of the record.
Okay, terrific. All right, let's go to a couple of questions. I want to maintain the conversation that we've been having here on Medicaid, if you don't mind. Nevada, as you're probably well aware of, is one of 32 states that chose to expand eligibility for the Medicare program. Numbers since the expansion, Nevada Medicaid enrollment increased from 350,000 to over 600,000. As of July 2016, Medicaid enrollment in Nevada is over 200,000 people greater than what was projected before the expansion. I've had numerous conversations. I had a conversation with the governor. I've had conversations with state employees. Okay. I've had conversations with state employees, our state legislature, our hospitals, that are all very seriously concerned about moving this program to a block grant. They're concerned that they will not have the appropriate funding to cover clearly all 600,000 Nevadans that are on the program and that are on Medicaid. And they're concerned that they do not have the staff to implement such significant changes. They're also concerned that with a part-time legislature, the state will not have the time needed to establish drastically different Medicaid programs. So I guess my question to you is whether or not you're sympathetic to these concerns for these block grant states, these expanded block grant states like Nevada, and do you understand those concerns?
I absolutely understand those concerns. I've worked with states for almost 20 years now, so I understand the concerns. I understand the state budgets. I understand the states that have expanded and the states that haven't expanded. We want, I think in terms of the Medicaid program, for me, the opportunity is about improving health outcomes. We're talking about a very vulnerable population. These are individuals that, it's a safety net. Medicaid's a safety net. They don't have another place to turn. If you're disabled, if you're a quadriplegic, if you're paralyzed, Medicaid is the program. But what we have today doesn't work well. I mean, we know that studies after studies have showed that the outcomes aren't great. We know that states are spending different amounts of money, $4,000 in one state, $12,000 in another state. And do we know that we're getting better outcomes? Do we ask these individuals about their care? So, I think that the conversations that we're having should all be around improving health outcomes and trying to do a better job here. I don't want to be about hurting states. That's where I come from. That's what I understand. I've worked with a lot of different governors, and I understand that, where they are in terms of state budgets, and there's not a whole lot of extra money. But I think this is about giving states, putting states in a leadership role so that they can manage their programs better. I think that when states are closer to the people that they serve than the federal government, and they have a better understanding of what can work in their state than the federal government. I think we've heard from some of the senators today about rural areas, for example. They have special challenges there in frontier areas. So some of the things that are coming down from Washington in terms of a one-size-fits-all approach doesn't always work. I think states should have that flexibility to design a program that works better for the people that they're serving, and they're better positioned to make those decisions than we are in D.C. So I think that this is an opportunity to create flexibility so that they're not having to go to the federal government every time they want to make a simple and routine change. And what we've seen in the Medicaid program is that because it's so inflexible, there's not a whole lot that you can do in designing your program. And so what states do often when times are tough is they cut provider rates. In 2012, we had over 44 states either freeze or cut provider rates, and that has an impact on access to care. But they're doing that not because they don't care about the people that they serve. It's because the program is so inflexible. So I think an opportunity to give states more flexibility is an opportunity to improve health outcomes for individuals.
So is it fair for me to say that you're pushing a block grant approach?
I am pushing, an approach that improves the Medicaid program because I don't think the status quo is acceptable. I think we can do better for disabled people and for people that are very vulnerable and that are dependent on this program. I think we can do better improving outcomes and making sure that individuals aren't receiving health care in the emergency room and that their health is actually improving.
My time's up. Are block grants on the table or off the table?
I think anything should be on the table that can improve health outcomes for this very vulnerable population.
Okay. So it's my understanding that then block grants are on the table.
I think block grants, per capita cap, anything that we can do to help improve outcomes and create a level of accountability for states, I think we should explore all of those options, and I look forward to working with Congress on this.
Ms. Furman, thank you.